Dr. McCain, if this patient, let's say, fails hedgehog inhibitors, what are the options in terms of systemic therapy? Do we have data?
So I think for a patient with a basal cell carcinoma that has failed the hedgehog inhibitor, I think your first thought should probably be anti-PD-1 or immune checkpoint inhibitor. We know that these patients have high tumor mutation burden, and we've seen some data showing that there's high response rates and some durable responses to anti-PD-1. So although not approved, I think trying to look for a clinical trial for a patient to be able to have an immune checkpoint inhibitor would be a great next step.
I agree. I would also pursue a clinical trial for these patients, but that, also with anti-PD-1 antibodies, understanding the data. Interesting that for superficial basal cell carcinoma, TLR7 agonist imoclomid is an option, and it works well. Speaks for the potential immunogenicity of these tumors. We know that they have a high tumor burden as well, which mutation burden, a high mutation burden in the tumors, which also, again, has been associated with a likelihood of response to immunotherapy, specifically immune checkpoint inhibitors. Exciting ongoing studies with anti-PD-1 antibodies. I would do the same. Unfortunately, because we have limited data otherwise, and it is related to the fact that this is a rare tumor, and therefore most of data that we have in terms of chemotherapy, for example, are based on case reports and case series. So limited guidance is available to us, in the community in terms of other options. So hedgehog inhibitors is the first line of treatment for inoperable disease. Radiation obviously is an option, and in patients who cannot tolerate, a clinical trial with anti-PD-1 antibodies appears to be the next best option as well. Thank you to Dr. McCain, Dr. Wong, and Dr. Emmerich for your thoughtful case presentations and lively, informative discussion. To our viewing audience, thank you for joining us for the Targeted Oncology Virtual Tumor Board presentation on skin cancer. We hope today's discussion was a valuable use of your time and that you acquired some practical knowledge that you can take back to your clinic.